Hey, Dr. K, what's the leading cause of male mortality as you age?
So the leading cause of male mortality as we age changes. Up until about the age of 40, 45, the primary cause of death is trauma, injuries, accidents, etc., related to the workforce. After that, we start to get into cardiovascular disease, heart attack, and stroke. By age 20, as much as 50% of the male population have hypertension. Hypertension, obesity, diabetes are major risk factors for the development of cardiovascular disease, heart attack, and stroke. The big three things that you can do to try to avoid some of these health risks are to get preventative care, to go see a doctor and have a workup for some of these things that do not become evident until you have a problem. Hypertension and diabetes are silent until there's a big problem, so you need to get screened for that. The second is obesity. As much as 40% of the male population in America is overweight. So controlling your weight is very, very important to reduce these risks. The other part is smoking. Anywhere from 10 to 15% of the male population still smokes. That's a significant contributor to cardiovascular disease, pulmonary disease, stroke, and ultimate death.
Hey, Dr. K, is there a higher cancer death rate in men?
Men also have a higher cancer risk and death rate than women. The major factors around that are smoking, alcohol use, and occupational exposure to chemicals. What's the best way to reduce your cancer risks? Men are also 50% less likely to go to the doctor for any complaints or for primary care than women are. So it's being aware of those risks, obviously reducing or eliminating smoking, reducing or eliminating, controlling alcohol consumption, and understanding your risks on the job environment and taking those protective measures.
Hey, Dr. K, why does it seem that women live on average 5 more years than men do?
Why do women live longer than men? Well, a lot of that has to do with occupation. Men are generally in more hazardous environments, exposed to more chemicals, exposed to more trauma risk. Men also have higher rates of alcohol use and abuse, and again, that raises the trauma rate. Men are less likely to seek any kind of preventative medical care, to go to the doctor, to complain to anyone, and that leads to much later recognition and treatment of a lot of these chronic conditions we're talking about. So the best way to try to mitigate some of the problems and maybe live a little bit longer is to seek primary care. General health checkups, looking at your blood pressure, looking at your blood sugar, and checking your hormones. Hormone levels changes in men are common as well with age. Thyroid hormone changes, testosterone hormone changes. A lot of these things can affect your activity, your weight, your mental health, depression. These things being checked early can avoid problems later on.
Hey, Dr. K, what's another way that men can stay healthy and live longer besides listening to women?
What can men do other than listening to what our women are telling us? We can listen to each other. We can talk. We can be open. We can listen to ourselves. So it is true that women probably pay more attention to us and our problems and our overall health and well-being and mental status than we do. But again, you need to listen to what they're saying. You need to listen to what they want to hear. They want to hear you express your feelings. They want to hear you express how you're feeling physically, and they want you to get help. And then, maybe we'll start to live as long as they do.
Hey, Dr. K, my body just can't do what it normally can do, and it's bumming me out. Is a mental checkup just as important as a physical checkup as we age?
Along with the mental health challenges, men have an extremely high rate of completing suicides. Women have more mental health complaints. They seem to get mental health quicker than men do. Men are quite delayed in reaching out to get any kind of mental health issues addressed. At about 75% of the completed suicides are by men. Again, on top of that, we don't talk to each other. We have a higher use of alcohol. We tend to internalize problems, not reach out to other people to try to get some assistance. The early signs of significant depression can be tiredness, can be lack of interest, can be easy, angered. Some of these need to be addressed and attended to early. like any other medical condition. The longer you delay in trying to get any kind of help with that, the worse it's going to be for you and the harder it is going to be to resolve. It's like a pain in your chest or a pain in your leg. The longer you ignore it, the worse the problem's going to be when it's ultimately diagnosed. So here's the bottom line. If you want to live longer and enjoy it, there's a couple of things you need to do. Number one, talk to somebody. Go get your blood sugar checked. Go get your blood pressure checked. Talk to your doctor about your feelings. Talk to your doctor about your health. Talk to your doctor about checking your hormone levels, your prostate, your thyroid, your testosterone. Drink alcohol in moderation and avoid cigarettes. If you want to live longer and enjoy it, this is the key. So if you have a question you want us to address, just reach out and say, hey, Dr. K, and we'll get back to you. For the Harris County ESD 11 Mobile Healthcare, I'm Dr. J. Kovar.